We are really thrilled to welcome back Alyssa Sutton from the International Foundation for Gastrointestinal Disorders.
We are going to talk about diverticulosis and diverticulitis. Just to give you kind of a history of our organization, I am from the International Foundation for Gastrointestinal Disorders. Typically, we're referred to as IFFGD for short. It's much easier to say. But our organization was founded in 1991. It was founded by one woman named Nancy Norton. She was actually diagnosed herself with fecal incontinence right after giving birth to her first and only child. So she kind of just started attending conferences, started talking with doctors, built up this whole organization, and it branched from just being fecal incontinence to then functional GI disorders to now where we are with motility disorders, rare disorders. We still cover our functional GI disorders, but we really try to bring that awareness to the community. We are an international nonprofit, so we do serve everybody from the USA beyond. We work with different patients, families, researchers, employers, regulators, and other people in order to kind of help bring that awareness and support the research that goes into GI disorders. One of the main things we do, education advocacy event, we do that typically once a year, sometimes twice a year, it just depends, where we advocate for more funding towards GI. We also try to ask for different bills to be passed. I know if you're keeping up with the legislation recently, there's something that is called the Safe Step Act that we're trying to get passed. And really, it just kind of helps increase a patient's access to care. I wanted to start out with kind of the basics of talking about diverticula versus a diverticulum. So a gut diverticulum is that singular form of an outpouching that is present on the wall of your gut. And it kind of just forms a sac or a pouch. You can kind of see in the image over here, but you can see that pouch forming right there outside of an intestinal wall. Diverticula is the plural form. So when you have multiple diverticulum, we refer to that as diverticula. And these can occur at pretty much any level of your digestive tract. However, they're most likely going to occur or be found within your colon. So today I'm really going to stress kind of talking about colonic diverticulum versus diverticulum that you'd find throughout the digestive tract. When the diverticulum or the diverticula become present and you have more than one, that is typically when you're diagnosed with diverticulosis. In order to be able to classify yourself as having a diverticula or diverticulum, there are two different ways. So the first is called a true diverticulum. And this is where it includes three different layers of your gut, which is your lining mucosa, your muscle layer, and also your outer serosa layer. If you've been diagnosed with something called a false diverticulum, that is when the muscle layer, which you can see on this bottom image, is missing. And so therefore, it's kind of a very thin-walled structure. False diverticulum can also be referred to as pseudodiverticulum. It kind of just depends. But again, when these things are present, even if it's false, even if it's true, your healthcare provider will most likely say, okay, you have diverticulosis. And if inflammation is occurring near the site of the outpouching, that is when you'll be diagnosed with something called diverticulitis. And I'll get into more of that a little bit later. So diverticula, like I said, can appear throughout the digestive tract, but most commonly are found in the colon and specifically in the left colon, which I'll talk about in another slide to show you where that left colon is. It's pretty common in the United States alone. More than half of the population will have at least one diverticulum in their lifetime, and then that will increase to having more than one diverticulum if you are over the age of 60. Now, this diagnosis, this condition was actually typically considered a condition that only affected individuals that were older, so 60 and over, but it's becoming increasingly more common with younger individuals. And that could be for a variety of reasons. It could be related to diet, but it could also be that I know they've kind of bumped up the age of being able to receive a colonoscopy. I think more people are becoming aware of the fact that they get a colonoscopy, and so this type of thing can be found when you have that type of procedure done. Diverticulosis, like I said, is found during that colonoscopy. It's typically found incidentally. So typically somebody's not going to go in for diverticulosis symptoms and say, hey, I think I have this. Can we check for a colonoscopy? You're typically going to have a colonoscopy for another type of reason. Maybe it's just routine. And so this will typically be found then. A colonoscopy, if you're not familiar with what that procedure is, it doesn't require any surgical incisions. They just use an endoscope, which is a very long, flexible tube, and it has a camera with a light right at the end of it. So that way they can see through through the anus and the rectum to be able to kind of get that image of your lower GI tract. Diagnosis of diverticulosis is more common in European countries as well as Australia, and it's less common to find in Africa or Asia. And that's kind of just speculated to be due to differences in diet, lifestyle, and also just their detection technologies. So talking about what causes diverticulosis, really this is kind of still not completely understood. You can see, I mentioned earlier, even from this image, the left colon right here, we also refer to that as the descending colon. This is typically where the diverticula are going to occur. It's right here in that descending colon. So even though we're not completely understanding the cause of diverticulosis, it's believed that it's caused by pressure created by pushing the stool, and it pushes against the colon wall, which leads to kind of that weakening of the colon wall, and then it kind of creates that little outpouching. The muscle layer near the site of the left descending colon is often thickened, which kind of does support that theory that it is created by high pressure within the colon. And this can result in all of those bulges of outpouching, which create more diverticula. And this is also where arteries are located. And so you can have symptoms of bleeding and things like that. But just so you know, people with connective tissue disorders are also more likely to be diagnosed with diverticulosis in the future. So now thinking about symptoms, most individuals who have colonic diverticula are unaware that they have them because they don't typically cause any symptoms. Diverticulosis is often, like I said, in that incidental finding. It's usually seen on either the colonoscopy or a CT scan for reasons that they're looking for other than having diverticulosis. There is a little bit of controversy, just like there is with the exact cause of this condition, surrounding also the symptoms of this condition. So some healthcare providers believe that if you have diverticulosis, you'll still experience some symptoms. Some believe that you'll only have symptoms if inflammation is present. Now, some common symptoms that can be troublesome for patients if they have diverticulitis or diverticulosis can be abdominal pain, bloating, or changes in your bowel movement. So whether you're going back and forth from diarrhea or constipation or whatever kind of your norm is, it changes. These symptoms are very similar to irritable bowel syndrome. And so when you go in and you present these three symptoms to a healthcare provider, it's possible that they'll treat it just like having IBS. Other providers may take it one step further to say, oh, well, it might not be IBS, it might be diverticular disease. The way that they treat it will kind of vary depending on the healthcare provider that you see. And that's why we kind of stress that since they're so common, you really want to hone in on exactly what your symptoms are, what's triggering it, how often are you experiencing this abdominal pain, what level of pain are you experiencing, is it being associated with any fever or vomiting or excessive diarrhea, because this is going to help that healthcare provider determine the right course of treatment for you. So moving kind of from diverticulosis, which again is kind of just the presence of that outpouching, typically doesn't cause any symptoms, really not something to be super concerned with, as like I said, more than half the population will experience an outpouching at some point in their lives. But when that diverticulum become inflamed or they can burst, it causes inflammation, which will then lead to pain in that location. This can often be associated with high fevers, a loss of appetite, or those changes in the bowel movement. People that are at a greater risk of developing diverticulitis are people that have chronic inflammatory conditions. So these people, their bodies are in an inflammatory state for over several years. This can include things like your cardiovascular disease. It can include diabetes. It can include obesity. And these things are going to kind of make you more susceptible to a condition like diverticulitis. Some other risk factors, if you're not somebody that has that chronic inflammatory state, that can also lead to developing diverticulitis is if you are a person whose lifestyle habits do not include physical activity, if you smoke cigarettes, if you use medications such as NSAIDs like ibuprofen. Those also your non-steroidal anti-inflammatory medications. Those steroids or opiates, those people that use that kind of more chronically in everyday usage are more likely to experience diverticulitis as well. When you're diagnosed with diverticulitis, you're going to be diagnosed with one of two different types. So the first type is called a complicated diverticulitis. This is going to be your more rare as well as your more serious condition. Complicated diverticulitis is really when there's complications that are associated with your diverticulitis and also when you're continuing to get reoccurring symptoms. This is often diagnosed if they find a pocket of pus, which is also known as an abscess, and when that is found in the colon, or if there is a hole or type of perforation within the small intestine or the colon that is present. Patients that do have this type of abscess can become really ill, and the pus from the abscess will eventually potentially need to be drained through a large needle, and this can be done by a radiologist or it can be done by a surgeon. In more rare cases of your complicated diverticulitis, you can also get something known as peritonitis. And what this is basically the perforation of the peritoneum, which is the area between your skin and some of your visceral organs like your heart, your lung, and it also can include the organs of your digestive system, your excretory system, and also your reproductive and circulatory systems. But it's basically when you have a perforation or that hole within that part of your skin, and it can require emergency surgery if it gets bad. Kind of going back into the abscess, if you are experiencing an abscess and the abscess is very bad, it's infected more of the colon than what they thought. In some severe cases, what a surgeon will do is they will bring out the colon towards your skin and they'll hook the contents and temporarily collect the contents into a bag called a colostomy. Later, once that infection or once that abscess has kind of calmed down, the infection has settled down, the infected colon will be removed, and then the colon can be rejoined. You can get rid of that colostomy bag. Again, those are more rare cases and only for those serious type cases. Other complications of this diverticulitis are a narrowing of the colon, which can lead to obstructions, or something called anal fistulas. If you don't know what fistulas are, it's basically just abnormal connections between different body parts, which in this case can include not just your anal cavity, but also the colon to the bladder, your small bowel, your vagina, and different parts of your skin. I know it kind of can be scary to learn about the biggest complications, but like I said, these are very rare. You can still have complicated diverticulitis and not experience any of these things. And so it's not to scare you, it's just to remember that these things have a potential of occurring, and that's why it's so important to talk to your healthcare provider. So the next type is called the uncomplicated type of diverticulitis. This is your most common type of diverticulitis. It's typically diagnosed when the diverticula is found with episodes of localized abdominal pain, and that pain is associated with an infection and also some inflammation that's occurring. Treatment of something like this is typically just to consume a low fiber diet and also resting until your symptoms are able to subside. I know when we think infection, we think inflammation, we think antibiotics. A lot of recent studies have shown that just doing the low fiber diet and the rest can heal you just as fast as being on an antibiotic. So that's why we typically like to stay away from antibiotics when it's diagnosed. But if you're somebody that lives with something like a compromised immunity, or you have reoccurring symptoms of diverticulitis, or if you have ever had complicated diverticulitis, then you may be asked to take an antibiotic in order to kind of help. If you've already had one pouch, it's very likely that you could get more pouches and things like that. So I just wanted to touch on diverticular bleeding. The reason why you may have a diverticulum or your diverticula bleed is because your arteries inside of your colon can run through that diverticula. And though it's uncommon and rare, these arteries can eventually wear through the thin wall of the diverticulum and cause bleeding. In more rare cases, this can be life-threatening to you. If it's something that you're experiencing, you may have initial symptoms of feeling faint or the appearance of very bright red blood in the rectum area. These complications often require hospitalization and or a blood transfusion depending on how much blood is lost. It can be detected with something called a CT angiogram, which is a type of CT scan, otherwise known as a bleeding scan, and it can typically locate locate that source of the bleeding for radiologists. They can also do an angiography, but it's a different type of x-ray. It locates blood cells within your colon, and so it can also help you target that source of the bleeding in real time and being able to treat it. Attempting a colonoscopy, if you have active bleeding, is going to be a lot more difficult with that technology. So that's typically your least common way of detecting diverticular bleeding. Now, fortunately, the bleeding will usually stop on its own, but in around a quarter of cases, it can recur. Surgeons might need to remove the segment of the colon that contains that bleeding diverticulum. So talking about your diet and diverticulitis, I know I mentioned that if you have diverticulitis, especially if it's uncomplicated, they'll most likely say to do a low fiber, low residue diet. One example of this is called the BRAT diet, and basically it just stands for bananas, rice, applesauce, and toast. Spells out that word BRAT for you. If you are somebody that in the past have experienced chronic diarrhea, it may have been advised that you take the BRAT diet, because what it essentially does is it slows down the intestines and decreases the movement of your bowel movements. The BRAT diet, though, is not very nutritious. As you can see, it's very limited to just the bananas, rice, applesauce, toast. So it's not something that a patient should be on long term. As a starting point, we want to just kind of warn people to stay away from any extreme diet changes with the BRAT diet. So avoiding all fiber in general is not always the best thing to do, especially because our bodies need fiber. I'm going to talk about the importance of that later. Don't limit your diet to just being only liquids. Again, you want to make sure that your diet remains as nutritious as possible. Don't cut out all liquids, as it also can get you really dehydrated. Make sure you include foods that have lots of sodium and potassium, as these can contain the electrolytes that you can lose if you have something like chronic diarrhea. So this is, again, something that you would do very short term, not something that you would be on for a long period of time. And I'm going to talk about ways to find a dietitian so that way you can maintain the nutritional needs that your body needs while also kind of being able to slow down and help the inflammation of that diverticulitis. Fiber is super important to our diet. Even though for diverticulitis, they recommend low fiber, but if you maintain a high fiber diet throughout your life, you'll essentially have fewer episodes of diverticulitis, and it can help you prevent diverticulitis from occurring in the first place. So maintaining that high fiber diet is super important. Fiber is known to soften your stool. It's known to improve your constipation if that's something that you struggle with. And it also has some secondary benefits as well. So not only will it soften that stool, but fiber a lot of times will act as that prebiotic, which promotes the healthy growth of bacteria within your gut. And it can also be associated with fewer colon polyps in the future, which is basically just a small clump of cells that form within the lining of your colon or your rectum. But having that high fiber diet is so important. So if you're not somebody that's struggling with diverticulitis, including high fiber into your diet is something that would very much benefit you if you either have one diverticulum that's been located on a colonoscopy, or even just in general to maintain a healthy diet lifestyle. One thing to note is that your diverticula is not going to shrink over time, and there's no way that you can get rid of them. Once they occur, they're pretty much there forever. However, like I said, most people don't know they even have one. They're never going to have symptoms, which means that you're not going to have any type of problems that come from having diverticulosis. Like I said, those studies show that a high fiber diet can be associated with less flare-ups of diverticulitis or preventing diverticulitis in the future. You can also help yourself not lead to diverticulitis by maintaining a healthy lifestyle. So including things like lots of fruits, vegetables, protein into your diet, avoiding tobacco or cigarette smoking, including that moderate exercise throughout your weeks. All of those things are excellent, not only for your overall health, but can also reduce your risk of diverticulitis. There was a study, and I'm not sure what year it was done. It was actually done with men, but it was a nationwide study, and they found that the men that exercised regularly had fewer episodes of diverticulitis and were less likely to even have diverticulosis or diverticular bleeding. So that really just kind of maintains that theory that if you have a healthy lifestyle, if you're eating right, if you're working out, if you're doing what you need to do, you're not putting toxins into your body like cigarette smoking and tobacco, all of those things are going to help in the long run. It's important to talk with your healthcare provider. If you've ever been told that you have diverticulosis, it's very useful to know if this is present because it can help your provider in the event of an attack occurring, or if bleeding occurs that can otherwise be just like an innocent little colonic outpouching. So it's a better way for them to understand how to treat it if it happens, if they know that it already exists. Also, if you've been diagnosed with diverticulitis in the past, it's always good to mention that to your healthcare provider because it's important to ask if you need to have follow-up colonoscopies in the future to make sure that you're not getting more or that you're having more complications from it. It may be a different course if they recommend that you get follow-up colonoscopies and how often that occurs, but it's just important to ask those types of questions, especially if you've had complicated diverticulitis. Many people ask whether or not nuts and seeds can cause acute diverticulitis and whether or not these types of foods should be avoided in your diet in order to prevent a diverticulitis attack. The evidence supports that the high fiber diet helps. So that means eating nuts and seeds in the high fiber diet can actually prevent the diverticulitis. But there are rare cases where a person who has had diverticulitis in the past has noticed that when they eat nuts or seeds, they do have a flare up or it is a trigger for them. And so they get an attack of diverticulitis. Now, this can be speculated because types of food can get stuck in that pouching, which creates that inflammation. But it doesn't mean that it's necessarily going to happen every time you eat a nut or seed. But it's clearly understandable if you're somebody that noticed that nuts or seeds do irritate you, do cause a flare up, that you're going to avoid those completely. If you are somebody that avoids them because they do trigger something, it's important to still get that high fiber so you can kind of steer away from those nuts and seeds by introducing nut butters, roundup seeds, or other ways to kind of pre-digest your food that can otherwise be considered hard foods. In our organization, we have started a brand new series called 5 Minutes in GI. And what we do is we introduce a question that we get from our patients or a question that has just been asked multiple times, either through Google platforms or on our website. And we ask a healthcare provider to try to answer that question in 5 minutes or less. That way, it's like a clear and concise response for the patients. It's not long and drawn out. But the most recent one that we did and that we launched at the beginning of April was called Diet and Diverticulitis, which was perfect for this presentation. So research doesn't show that any particular food, I just want to throw that out there, can cause diverticulitis. So doing something like excluding those nuts and seeds from your diet is a completely personal decision. It's not something that is always recommended. But if you want to learn more about the diet and diverticulitis, I do have a QR code right here that you can scan. And also you can see any of our other 5 Minute in GI episodes by going to our YouTube channel, which is just youtube.com/IFFGD. Dr. Joy Liu, she actually works in Northwestern in Chicago, Illinois, and she specializes in lower GI disorders. And so she did a really great job in kind of explaining the importance of maintaining that high fiber diet and also the importance of monitoring what triggers your own symptoms. If you are somebody that has had diverticulitis in the past and diet is something that you do struggle with, especially if you notice that you're restricting your diet in any way and possibly not introducing as many great nutrients to your body or, as many vitamins that you need, we do offer a complimentary dietitian listing. Right now, we have over 150 providers who specialize in GI disorders specifically. This is a great tool to start with. You can always ask your healthcare provider if they can recommend a dietitian. I know sometimes with insurance companies, it's different whether they're going to cover that dietitian or not, but a lot of times a GI physician will work alongside of dietitians. So it's possible they can recommend one. It's possible they can help provide some minimal diet advice, but our website allows you to also search for a GI dietitian by either your symptoms or your GI condition or the area that you're located in. I know a lot of physicians since COVID and dietitians have gone to the telehealth medicine. Even if you search in your geographic area, if you don't find anyone, it's possible you can just reach out to our organization that another dietitian is registered in multiple states. So you can actually visit them via via telehealth, and it doesn't always need to be an in-person visit. And again, that QR code is there if you're somebody that's interested and wants to get to the website to search. If you have a question, you can find out more information on diverticulosis or diverticulitis. That same physician that did the 5 Minutes in GI series, we had her review our diverticulitis and diverticulosis information just to make it as most current as possible, because I know there's been a lot of recent research looking into these types of conditions. So we just updated that. So all of this information is current for 2024. And you can access the free fact sheets. You can always follow us on Facebook, Twitter, Instagram, or our YouTube channel to get more updated information on anything related to GI disorders and GI research.